We're seeing 500,000 new cases of carpal tunnel syndrome pop up yearly. Clinical studies show there are very specific nutrients needed for the median nerve to be repaired. Did you know that a staggering 400 million people worldwide struggle with carpal tunnel syndrome? And in the U.S. alone, 17 million are affected, with 500,000 new cases popping up every year. Imagine trying to hold a glass or type on your computer only to feel pain and tingling or even weakness. Now, if you think you might have it but haven't been diagnosed yet, you'll want to take a look at these symptoms. You might notice a sharp, aching, or burning pain in your hand, wrist, or fingers. But have you ever wondered why you don't get symptoms in your pinky finger? Well, that's because the median nerve doesn't go there. It only controls your thumb, your index, your middle finger, and part of your ring finger. So it's not uncommon to experience tingling or numbness creeping through those fingers. Some people experience that annoying pins and needles sensation, which can worsen at night and disrupt your sleep, making mornings unbearable. As the condition progresses, you may notice your hand getting weaker. It may become more difficult holding on to things, and opening a jar becomes an Olympic event. If you've ever had to ask someone to open up your favorite pickle jar, you're not alone. And sometimes people will say they feel like their hand is swollen even when it looks perfectly fine. It's very common for carpal tunnel sufferers to have any combination of these symptoms. So let's delve into what causes this to happen. The median nerve runs from your spinal cord down to your hand. If it gets squeezed or pinched, it can lead to pain, tingling, or weakness in your hand. So let me give you a visual. Imagine a very large man wearing a cowboy boot stepping on your bare foot with the pressure lasting for hours. That could cause some significant damage to your nerves. And this is really similar to what happens inside your wrist with carpal tunnel syndrome, which leads to pain, numbness, and weakness in your hand. Standard treatment methods for carpal tunnel syndrome like surgery, medications, or even bracing have been shown in research to be fairly ineffective. Common medications prescribed for carpal tunnel are corticosteroids, which can help reduce the swelling and the inflammation, but it doesn't address the nerve damage, making it nothing more than a temporary Band-Aid. The same holds true with bracing. Although it may be useful at night while you sleep to prevent a prolonged stretch on the nerve, especially if you're sleeping with your wrists bent, it's still not fixing the damaged nerve. Now, physical therapy along with chiropractic care has been shown to be extremely effective for mild to moderate cases of carpal tunnel syndrome. And there are also a lot of other great treatments such as photobiomodulation or PBM. That's been shown to have many promising results in carpal tunnel recovery, especially for severe cases or for post-surgical cases that have gone bad. In fact, we did a video on the effectiveness of PBM, so if you missed that, I'll leave a link below for you. If you have carpal tunnel, you're definitely going to want to watch that video. But here are some important facts that aren't usually taken into consideration. Research also shows that in order for the median nerve damage to be repaired, the nerve has to have very specific nutrients. Otherwise, you might not fully recover from your symptoms or your condition might come back. So let's look at these vital nutrients and how they can help you. Clinical studies have shown that to repair nerve damage and maintain the health of your median nerve, you'll need these vital nutrients. First, let's start with the specific B vitamins like methylcobalamin, benfotiamine, and pyridoxal 5-phosphate. These B vitamins in particular play an important role in the health and recovery of this nerve. Now here's what they do. These specific B vitamins are essential for the repair and regeneration of the myelin sheath, the protective outer layer of the nerve. They're also necessary for the appropriate speed and conduction of nerve impulses, and they play a significant role in nerve communication. Now, I do want to point out, when you look at many of the different research studies on B6, you'll find that the researchers used 100 to 200 milligrams of pyridoxine HCl, and this was used over a period of 2 to 3 months. However, we never recommend using this form of B6 because further research also shows that in high doses like this, and when used long term, it can actually have the reverse effect and begin to damage nerves. There is, however, a very safe form of B6 that we always recommend and we use for our patients, and that's called pyridoxal 5-phosphate. This form can be used for years at very high doses with no side effects or damage to the nerves. In addition to these B vitamins, studies have found that R-alpha-lipoic acid has many beneficial effects on nerve recovery, including the median nerve. Here's how it works. When you suffer from nerve injuries like compression injuries, it will result in a tremendous amount of oxidative damage, which causes elevated levels of inflammation. R-alpha-lipoic acid is the biologically active form of ALA, and it neutralizes free radicals to reduce the oxidative stress. This helps to reduce inflammation, and it protects the nerves from further damage. R-ALA also enhances blood flow to promote oxygen and nutrient delivery to the median nerve. Another great fact about this nutrient is that it supports mitochondrial function of the median nerve, and it stimulates nerve growth factors, helping with nerve regeneration. Now, another nutrient that is commonly highlighted in research studies because it plays a huge role in nerve recovery and in nerve regeneration is acetyl-L-Carnitine, which sometimes goes by Alcar. This nutrient has been proven to have tremendous neuroprotective properties. This means that it acts like a shield for the nerve, reducing the damage caused by the injury and preventing nerve cells from dying. Acetyl-L-Carnitine has also been proven to protect sensory nerves from damage. These are the nerves that create symptoms like numbness, tingling, and even pain. Research shows that Alcar doesn't just protect the sensory nerves, but it also helps them recover. And what's also great about this nutrient is that it's been shown to increase nerve regeneration, so the median nerve can actually replace damaged nerve cells and replace them with healthy nerve cells. Now, if you've watched many of our videos, you may have noticed that there's a strong overlap between the critical nutrients for peripheral nerve repair and these nutrients for carpal tunnel syndrome, and that's no coincidence. The median nerve is a peripheral nerve, which is why it requires the same nutrients. Now, here's the key takeaway, health warriors. To repair and regenerate your median nerve, you need specific nutrients like methylcobalamin, benfotiamine, and pyridoxal 5-phosphate, along with R-alpha-lipoic acid and acetyl-L-Carnitine. These help rebuild the nerve's protective sheath, they improve nerve signaling, and they support overall recovery. Don't overlook this. It's essential for the healing of that median nerve. If you're wondering how much of each of these you need to take, don't worry. I go over that in full detail in these two videos. I'll put the links down below for you. The right nutrients in the clinically effective doses of these ingredients are imperative for best results. For our carpal tunnel patients, we use the same exact formula for them that we use on our peripheral neuropathy patients, and that's our Neforia CM Gold and Nerve Defense. These two formulas contain everything that I just mentioned in the correct amounts. And just so you know, you certainly don't have to buy our formula, but just make sure that you're purchasing a good quality supplement and that you're taking the correct amounts of the nutrients because there's so much crap on the market. Okay, there are still a few other nutrients you'll need for your median nerve repair, like vitamin D and omega-3 fatty acids. These are also key players in this nerve's recovery and function. These nutrients maintain nerve cell membranes, they reduce damage from oxidative stress and inflammation to the nerve, and they improve nerve function and regeneration. In fact, low vitamin D levels have been associated with an increased risk of developing carpal tunnel. It's important to check your vitamin D levels on your blood work because 40% of Americans have low vitamin D. Optimally, your level should range between 60 to 100 nanograms per milliliter. If you do have low levels of this vitamin, especially once you drop below 50, you won't be able to raise these levels by simply sunbathing or taking 2,000 IUs of vitamin D. You'll need to take between 10,000 to 20,000 IUs daily, depending upon how low your levels may be, and always make sure your vitamin D is complex with K2. For omega-3s, the research shows you should take approximately 2,000 to 4,000 milligrams of fish oil. We always place our patients on a liquid fish oil when taking quantities this high. Otherwise, you'd have to take somewhere up to 10 omega-3 capsules to achieve this dose. Don't worry, the fish oils are usually flavored with lemon or orange essence so they don't leave a bad taste in your mouth. Now, I want to take a minute to talk about pain and symptom management. While you're doing everything possible to heal the median nerve, it can be a bear dealing with the symptoms. So the first approach you should take is to reduce the inflammation, and this can be done without taking prescription medication. For our patients, we use all natural anti-inflammatories, and the one we like the best is by Pure Encapsulations. It's called Phyto Ultra Comfort. This formula is great at reducing inflammation and pain because it contains white willow bark, boswellia, and turmeric. Then, topically, for our patients, we recommend the same pain cream used for peripheral neuropathy symptoms. It's called Rapid Relief Cream. And what makes this cream so effective is that it contains several essential oils that have been shown in research to have potent anti-inflammatory and analgesic effects. All of the ingredients are natural with no chemical preservatives like parabens, propylene glycol, polysorbates, or dyes. Before we wrap up, if you found this video helpful, don't forget to subscribe to our channel and give it a thumbs up. Share it with someone who might be struggling with carpal tunnel syndrome. It could be life-changing for them. And click the notification bell so you never miss out on our updates on nerve health. Here's the final takeaway, health warriors. If you're experiencing pain, numbness, or tingling in your hand, especially in your thumb, index, or middle fingers, it's likely your median nerve is being compressed. The good news is, with the right nutrients, with the right therapies like PBM, and proper self-care, you can take back control of your life. Remember, we're here to support you on your journey to better nerve health. Check out the links below for more guidance, and let's get those hands feeling strong and pain-free. I look forward to seeing you on the road to great nerve health. Blessings. For our couple... For our carpal tunnel, oh my God! She sells seashells. Okay, can you reset me?